Good afternoon. I'm Rich Terapak, and I'm president of the CMC board. And in case you haven't already done so, as Jane asked, if you could please turn off your phones or leave them in some kind of status where you can tweet, and we encourage you to do that. Our hashtag is CMC Forum, and you can follow us on tweet at CBus Metro Club, CBus Metro Club. Before we get started today, let's talk a little bit about some of our upcoming events, and we have a bunch of them. There's one you won't want to miss next week. It's a special holiday restaurant review featuring culinary critics John Christensen, Brian Lindemood, Shelley Mann, Steve Stover, my good friend, and moi. And I do the restaurant reviews for WOSU, in case you didn't know. They won't let me talk much. They kind of hog the microphone, so I've got to get it in today. We haven't done one of these in about probably 3 years, but they're always a lot of fun. A lot of things you need to know about places to go during the holidays, and it's amazing how many new spots we have opening up. I think it's an indication of the vibrancy of our city and the fact that nobody likes to cook. The following week, we have count them, three CMC. I thought we got past this, Jane, in October when we did 2 a week. We have 3 the following week. Tuesday the 13th, we have billionaire venture capitalist Michael Mortz. Michael was an early investor, which we all had been, in Google, PayPal, Cisco, Apple, and continues to invest in a variety of internet other businesses. Hopefully we can get some tips. December 14th, we have the Harrison Bill Smith Legacy Forum, and that speaker, a little different approach, is a nationally known artist, Brian Toll. Make reservations for the CMC Jingle Mingle, which is our annual holiday party, and Not So Silent auction. It'll be held on the 15th at the museum from 5:30 to 8:30. Members can bring guests. They have to pay $35, but the 3 guests are free, so you can entertain some folks over the holidays. You can find information on the forums at our website, columbusmetroclub.org, and on the program, which is on the table. Take the program with you and display it someplace prominently, so we get some continued attendance like the 200-plus folks we have here today. It's always a treat to introduce new members, and we have several here today. If they could stand as I call their names, and we'll give them a little round of applause. Ann Gerlach with Jones Lang LaSalle. Ann, I saw you. Sherry Molney, a principal with Business Directions. Brian Scullin, and Beth Whitted with Planned Parenthood. If all of those folks are here, please stand and give them a hand. As Jane mentioned, if you're a guest here today and you're interested in membership, please let us know. You can tell the folks at the registration table on the way out. When you sign up, it's really not very expensive, and the first lunch is on us. And you can continue to bring guests. We want to thank the companies listed on the back of the program as well. These folks sponsor the forums and provide about 50% of our funding annually, and that helps us keep the dues low and hopefully the lunch price as well. Today's sponsor, this is the, I think, 4th in a series of Columbus during the month of November, sponsored by the Columbus Foundation, represented today by President and CEO Doug Kreidler and his associates. Doug. We're also extremely grateful for the tremendous advertising support that we get from the Columbus Dispatch, represented by Ben Morrison, their editor, and Director of Community Relations, Rita Wolf, and the associates at the Dispatch table. Today's forum also enjoys the support of McCladrey, represented by partners Bill Petrus and Director Alan Johnson, and their associates. So let's give them all a round of applause. Okay, now on with the program. The Columbus Metropolitan Club is again proud and pleased to provide the venue to announce the results of the Community Research Partners Study, Benchmarking Central Ohio. This is the 4th year of the project, which was funded by the Columbus Foundation and the Columbus Partnership. Our first panelist was named head of the Columbus Partnership 2 years ago. He previously worked as the Chief of Staff of Tennessee Governor Don Sundquist. served as Commissioner of Tennessee's Department of Economic and Community Development before Battelle brought him to town and the partnership stole him away. That's the President and CEO of the partnership, Alex Fischer. Our next panelist became Columbus Health Commissioner in 2002. Before moving to Columbus, she had a very challenging position as physician specialist with the San Francisco Department of Public Health, and she held that office during the emerging AIDS epidemic. Welcome, Teresa Long. Our third panelist is the Senior Officer of Community Reach and Grants Management for the Columbus Foundation. He's held positions with United Way of Central Ohio, the Dantner Company, Capital South Community Urban Redevelopment Corporation, and the City of Columbus. Please welcome Michael Wilkos. I'm almost done. Our moderator has directed the operations of the Columbus Research Partners, a nonprofit research center, since 2001. The organization works in and across a wide range of fields, including human services, education, health, housing, employment, poverty, community development, race, and diversity. Please welcome Roberta Garber and all of our participants. Bobby, it's yours.
Great. Thank you. It's my pleasure to be here today. This is a great crowd. This is fantastic. And share with you what we think are very important data for all of you to use in the work you do every day. I'd like to begin quickly by thanking our funders for this project, the Columbus Foundation and the Columbus Partnership. They're the ones who really make it possible for us to provide the data that all of you can use in the community. So we're going to start today with a PowerPoint, which I'll go through rather quickly. And I hate saying, I know you can't see some of this, but I found out when I got here today that some of the graphs aren't as readable as we thought, so we'll kind of flip through those quickly, and I apologize. You have at your table a little handout that has the table of contents so you can see all the indicators in the report, as well as the list of the comparison metro areas, so you have that. And all of the full report, highlights document, and a new companion spreadsheet that we've produced this year for the first time that has all of the data for the 100 largest metro areas in the country. All of that's available on our website, which is researchpartners.org. So let me get started. I want to just do a little overview about this, which is our fourth benchmarking report. Compares our area, the metro area, so when we say Columbus, we mean the metropolitan area, with 15 others. And the other communities are those that are comparable to us. Some of them are competitors, particularly in the economic development arena, and others are what we call aspirational communities that have things going on that we aspire to be like. This year we have 76 indicators in 5 categories, and we have one new category, lifelong learning, that we've added this year that pulls some indicators that were in other categories and adds some new ones. We use the most recently available data, but we attempt to have comparable years to the extent possible. So most of these data are from 2009. And we now have 5 years of data, so you can see 5-year ranking trends for the Columbus metro area. We have some new things this year. There are 18 new indicators. We have the new category and the 100 metro spreadsheet. So if folks say, why don't we have Pittsburgh and why don't we have some other community, you can go in and pull whatever comparisons you want and take a look at that. So before I get into the data, just some sort of contextual comments. When we talk about this report, we like to say it's more like a dictionary than a novel. And that is that you can't necessarily read from front to back and come up with a nice ending or a nice beginning. But it's like a dictionary in that you open a dictionary, you can pull words out, you put them together to make a sentence. Different words might mean different things in different contexts. This is a resource document like that. We find, as we look across, and it hasn't changed, that we see characteristics in Columbus, in the Columbus metro area, of growing communities and characteristics of declining communities. We're kind of a hybrid, an anomaly, and so that's why some of the things as we talk, people will say, well, these aren't consistent, it's a little counterintuitive. We've really got a mixed bag, and I think that produces opportunities and challenges. The other thing is we have to remember that these are rankings, so it's all relative. Our ranking can go up and down, and that may have nothing to do with what's happening in the absolute number or percentages for Columbus. It happens because other communities' numbers change, and so our ranking changes. There are paradoxes. We've had some conversations about this, why one piece of data seems contradictory to another. And the question we always get asked is, well, why do you think this is happening? And the disclaimer is, this is the what. It takes all of us to come up with the why. The other thing is, better may not be good enough. We may rank #1 in some area, and it's still not where we aspire to be with relationship, for instance, to unemployment. We may do better with unemployment. Unemployment still might not be low enough for us. So we ask you, as you look at this report and over the next months, to bring your perspectives, your experience. You're going to see it in different ways, and that's what we think is really important. So let me tell you a little bit about what the findings are. In our first section, population vitality, it's kind of contextual. It talks about what's happening with our population. And we find that we have moderate population growth, so kind of in the middle there. We have a younger population overall than a number of the other metros, and actually getting a little bit younger. We're less diverse in terms of race and ethnicity, but we rank third in terms of the percent of new immigrants in our community, so becoming more diverse. We have moderate levels of residential segregation in our community, and we do have a fairly high percentage of people living alone. So that's our context for the other indicators. Our first section is economic strength, and if I was going to say what's the big takeaway from economic strength, it's we're doing pretty well. Most of the indicators, the rankings, we're in the top half, which is good. So you see that we have a list here of things where we rank 1 to 5, which is in the top third of rankings, and it's a fairly lengthy list. So we were doing well in terms of the percent of our employment that's in business and professional services. We're off the charts compared to other communities in employment gain in warehousing, transportation, and utilities, which is where logistics falls, in the logistics area. Gains in management and professional jobs. We're near the top in terms of number of Fortune 1000 companies, although there's a big gap between the 1 and 2, which I think is Chicago and maybe Minneapolis, and the rest of us, but we're still up there. We have a fairly high percentage of IT occupations compared to other communities. And we have a fairly high percentage of medium-sized business firms, if you look at the mix of sizes of our businesses. We are near the top in percent of businesses owned by females. Younger communities, so we are doing well in terms of population of prime working age, and unemployment is relatively low, ranks third, although across the board, every community's unemployment rate went up between the last report we did and this one. Where are we not doing so well? We're not doing as well as other communities in terms of the business firms that we've lost more firms than others have. We really have lost a lot of jobs in manufacturing, retail, and financial services, and where we've done consistently not as well as in the small business arena. The new small business formation, very small business firms as a percent of our overall business environment, those are firms with 20 employees or less. We're not producing as many firms in that size. And we're not doing as well in what I would call brain gain, which is having adults move to our community with a bachelor's degree. So those are some things to look at in economic strength, and this is just a quick look at a couple of key indicators. This is Fortune 1000 companies. The orange is Columbus. The really light blue-green is Cleveland and Cincinnati, and the top one there is Chicago. So that's where we are in Fortune 1000, but this is where we are in the very small business firms as a percent of all businesses. We're really at the bottom. Okay. Personal prosperity is the next section, and this is the one where we see a lot of trouble signs. The words that describe this whole section are mostly bottom half. So where are we doing better in this section? You can see that we've got more on the right-hand side than on the left-hand side here. the income gap between the highest quartile of earners and the bottom quartile, or quintile, no, 10%, 90%, 10%, the gap isn't as great as in other communities. We're doing better than some other communities in women's income as a percent of men's. It's still not equal, but not as big a gap. And our housing is affordable here. So those are things that are where we're doing well. Where we're not doing so well, we don't have a lot of investment income, and that could be somewhat related to having a younger population. But median household income is low. Poverty rate is the highest of all of the metro areas. And related to that is persons receiving public assistance is a fairly high percentage. Foreclosure rate is high. And a new indicator this year, percent of children in families with no parent working. We actually had the highest percentage in that category, although it has jumped around a little over the 5 years, so we have to take that a little bit with we have to think about that and see how that trend continues. So this is income gap. We're up near the top in terms of 90th and 10th percentiles of income in the ratio there. And here's where we are with poverty. And this is not a new thing. If we look at trends over the last 5 years, 2 years ago we had the highest poverty rate. Last year it was second highest, so this is not something where there's been big changes. Community well-being is a big section. It addresses lots of different topics, which is why the rankings are kind of all over the place. It's not as coherent a group of indicators. So we have some things that we're doing better and things we're doing worse. So in this section we have things like health, safety, environment, infrastructure, community kind of volunteerism and celebration. So lots of different things in this one. We're doing well. This is a new indicator around local food growth, availability of local food, and one of the indicators is around agricultural land. So we have a lot of agricultural land, whether that's, what we think about that, we do. This year we're ranking well in terms of adults with asthma, although that's gone up and down a bit. We have good air quality. We have a high rate of volunteerism. Our traffic delay is low compared to other communities, even though we complain about it, we should be in, San Diego. And related to that is commute times are relatively low. And a new category, nonprofit community celebrations. We are #1 in nonprofit community celebrations. So celebrate. So where we're not doing so well, we continue to have high adult obesity rates, high adult diabetes rates. We used a new measure of charitable contributions this year, and we came out very low in terms of charitable contributions per tax return, only one measure of that, but still something to take a look at. We look at the number of public officials who are women, and I could do a long explanation about what we counted here, so we can talk about that if at some other point, but we're fairly low related to other communities in public officials who are women, and we looked at mayors, governors, and members of Congress, and there's a reason why we kind of stuck with those levels because of data availability. We have a lot of local government entities, which for businesses can be a challenge. Don't do much carpooling. We're low in commercial air traffic compared to other communities. We continue to be low in the number of arts establishments in our community, and a new indicator around our carbon emissions. We're not doing so well around vehicle emissions and residential heating fuel emissions. So lots of food for thought there. This is our obesity ranking, orange line near the bottom. And this is commute transportation mode, people who walk, bike, or use public transit. And we kind of put these together because we felt like there's a relationship between those two. So we're kind of in the middle on that, but probably not as high as we'd like to be. Last but not least is our lifelong learning section. This is a brand new section, pulled in indicators from other sections, added new ones. We're doing very well in most cases in this section. So percentage of our population that doesn't speak English very well is low. According to this data, the percent of high school age students who are not in school, which can be considered a measure of dropout rate, is low compared to some of the other communities. Our traditional college age student enrollment in higher ed is high. And we have a fairly highly educated population in terms of people with a bachelor's degree. Low in students eligible for free and reduced lunch, and this is one of these anomalies that have been brought up, like why is this low and poverty is so high? We don't know the answer to that. We're always doing well in our library usage, so we're number 2 in public library visits, and we're also very high in research doctorates awarded. So those are good things. Only a couple indicators in this one where we're not doing so well, and that is adults that only have a high school diploma. We have a high number of those. And we have a fairly low percentage of folks who have some college or an associate's degree. And we do a lot of research around workforce development, education, and training for adults, and this is an Ohio issue. It's not just a Central Ohio issue. So this is public library visits per capita, number 2, only after Cleveland. And this is pre-K enrollment. So this was another indicator. We're not as high on that. We're number 10 in percent of 3 and 4-year-olds that are enrolled in school. So something to think about. So last but not least, I think the question is for all of you, if we take data, we add people, and we have an informed discussion, it leads to action. And that's really what we're all about, is action. We want to see this data used, discussed, and we hope this is the beginning of that. These are questions that you can ask yourself about this. What does this say about Central Ohio from your vantage point? What did the findings mean to you? What do you think is right? What do you think is not right? What other information should we be looking at? And what should happen next? So again, up here, I don't know how well you can read it, but all of the information is available at our website, researchpartners.org. And so let me stop the presentation and move quickly to our panelists who are going to add their insights to this data. So I'm also the moderator, so I have a lot of power today. And each of our panelists are going to just take a few minutes, and I've asked them to answer a couple of questions, which is what was surprising in the report to you, and where should we be directing our community improvement efforts based on this? Are we focusing on the right things? Are there things we should be focusing on that we're not? So I'll maybe start with Michael and take it from there.
Right. So for me, I thought that one of the most surprising things was that how could there be indicators that seem to be in conflict with one another? So on the positive side, we had the 3rd lowest unemployment rate. We have the 4th lowest income disparity based on gender. We also had a low income disparity based on those at high income and those at low income, and yet we could have the highest poverty rate of any of the 16 benchmark cities. And so I think that hearing that statistic is hard for some people to hear it and to actually accept it and own it. And working at the Columbus Foundation, we're in this never-ending search for additional community knowledge. And we convene people every day to have conversations on all of these 79 different indicators. But it made me think about how do we develop our mental image of what poverty really looks like in our community. And so I found a recently released Brookings Institution report on concentrated poverty. And concentrated poverty would be those places where the poverty rate is 40% or higher. So those are the places where we develop a lot of our mental picture. That's where housing is in distress, that's where crime is high, that's where schools are failing. And based on that Brookings research, it showed that we have 25, I should say only 25, high poverty census tracts. But Cincinnati had 35. And Cleveland had 66, or almost 3 times the number of census tracts that were high poverty concentrated census tracts. So even though they have lower poverty in those regions, our poverty is more dispersed. So it's just harder to see. And just because it's harder to see doesn't mean it doesn't exist, and it doesn't mean that our response to it should be any less valiant in our efforts to address it. So I was really surprised by the high poverty rate and the fact that we could be doing so well in other broad measures of personal prosperity. But for me, it means that our solutions to address that issue will probably have to be a bit more thoughtful and probably more numerous in our attempts to address it than, say, our nearby cities. So the next question was, what does the report tell us about where our community improvement efforts need to be? Well, I think the report was pretty clear in some of the areas where we're not doing well, right? The highest percentage of kids that live in households where no one's working. We're 14th out of 16th with obesity and diabetes. low public transit use, the highest emission with regard to residential heating fuels, and of course the highest poverty rate. So it's kind of clear what some of the things are that we need to work on. But more than just the ranking of a city, I think the report's a valuable tool to help us understand where we need to dig a little deeper. So let's focus on poverty. A couple other things that we know about poverty in our community: it's suburbanizing at the fastest rate we've ever seen. We also know that poverty is moving away from downtown Columbus. We also know that poverty is impacting children more than it's impacting seniors. So a blanket approach to addressing poverty in Columbus probably isn't going to be the solution. That we're going to have numerous and targeted approaches to address poverty in our community. But I think the report also tells us another thing, and that is not one indicator tells the whole story. That where we are on a continuum of change is also part of the story. So overall, there were 18 indicators where we were improving. There were 12 where we were going down. There were 25 where we showed mixed improvement, and 14 that showed little change at all. So while 60% of those indicators had very little movement, we had more that were improving that were getting worse. And I think that's important to understand as well. So part of the story is not just about where do we rank relative to those cities, but what's the direction that we're heading. And so I think the report, for the perspective of the Columbus Foundation, is that our efforts around community knowledge are really important, because informed decisions can really be better decisions. And lastly, it allows us to put ourselves in a perspective, not just with a national ranking, but how does Columbus look compared to our peer cities, and how do we look compared to those cities that we aspire to be more like? And I want to quote the founder of the Columbus Foundation, Harrison Sayre, when he said, "The quality of a city consists not so much of what it is, but what it is becoming." And will we use this benchmarking study as a tool to guide what direction we're heading as a city? So the final question. Are we focusing on the right things? Well, the right thing is really a relative question, and there is no silver bullet approach. That's the easiest response. So the report had 76 indicators, so take your pick. We could look at employment, health, teen births, immigration, and certainly poverty. So the right thing for me, and I think a belief we have at the foundation, is that our community needs a strong nonprofit sector more than ever. We need them to be efficient, effective, honest, and serving more people than they ever have in the past. So an example for the foundation is our investment in the Fund for Financial Innovation, where we want to support transformative and pioneering ideas that demonstrate social innovation, social entrepreneurship, and of course, partnership and mergers. Because I don't think Columbus is going to have strong philanthropy if we don't have strong nonprofits in which to invest in. So what do we focus on? I think Columbus should focus on strengthening the capacity of our nonprofit sector, because probably the nonprofit sector, more than any sector in our community, is the front line of defense for many of the challenges that we face as a community. So if we strengthen the nonprofit sector, and where that sector shows passion and will, that's where I think our community issues will rise to the top.
Great. As a nonprofit, we think that's a really good idea.
Great. I'm sure you would.
Dr. Long.
Good afternoon, and I wonder if this is one of our community celebrations or a community conversation. It clearly is that, but how great to see you all here today. Because I think the first question posed to us was had to do with how surprised, or what was most surprising. And I'll be honest with you, I was surprised that I wasn't so surprised. Because my sense of this community, and actually this is a regional report. So again, I'm speaking really knowing Columbus, knowing Franklin County, and knowing some of our contiguous and neighboring counties. It was very interesting to me, and obviously the newspaper, and I appreciate the coverage this morning, picked up on poverty, because I think, just as Michael suggested, that is one of the somewhat surprising indicators, because it's broader and deeper, I think, perhaps than some of us would have imagined. However, and Bobby didn't say it, but she actually asked me when I chatted with her about this conversation to bring some more information to the table. And so the additional information, actually we are able to track health indicators and we relate them to other indicators a little more closely, and so they're not necessarily regional, though I can tell you that Delaware County ranks at a national level, ranks in our state as the healthiest county in Ohio, and Franklin County, Columbus and Franklin County ranks 66th. So we're putting together, one of the top and, 66 out of 88. So there is diversity just within our region, clearly. But then I think to really speak a little bit about what Michael was going after, this issue of poverty, and frankly, in my introduction, it said when I became health commissioner. I've actually been living in this community since 1986. And I know early on people asked me, well, what's the single most important health indicator? And I used to say poverty. And I'm thinking I need to get back to saying poverty, because frankly, I can tell you that if there is economic well-being in a community, and good to hear about the competitiveness that we want to compete with others, one of the things we have to do is address this personal prosperity issue, the economic strength of our community, and again, it's our region, to be able to successfully address the health indicators. And so it really is about us, and it's about all of us, both in this room and across all of the different sectors or silos or streams of work and non-work. And how are we going to work better together to address whether it's health or economic well-being or education? Because all of those, I assure you, the more educated we are, the healthier we are. And there's clear evidence. High school diploma makes a difference. You might be surprised, we're working with some of the patients that we serve to get their GEDs. We're helping them learn to read to their children, because if a child reads by 3rd grade, well, you may not know this. The prison systems in America make their bed projections by the 3rd grade reading level. So if a child doesn't read by 3rd grade, they know that that child will likely end up in prison. So then if you think about who's going to prison, I mean, there's all kinds of social implications to that. And so I guess I would ask you to consider, and I can speak about some of the disparities, because there clearly are disparities within the health indicators. You may have heard us speak about the infant mortality, but I can tell you that place matters. It matters by income. We can look at income by zip code, but you may not be aware that your life expectancy and your health status also varies greatly by your zip code. And that's not right. That's not fair. And that really has to do with floating the entire region's vitality, floating the entire region's economic strength, our education. And it will be in that process that we float health. And while I'm a physician, and I know that many of my healthcare colleagues, or some of them may be here, health is far more than healthcare. And so if we continue only to invest in healthcare, we will never dig deep enough to improve health. And improve, of course, community well-being. So I won't go into all the disparities. If you want to talk about that, we can. So what is it, how could we work smarter, better to address some of these issues? Well, I think there are a couple things. One is, it is about all of us thinking about at the different levels we work, both as individuals ourselves and in our families and in our neighborhoods, but in our workplaces and really across all of these sectors, and about the connectivity. Because as I looked at these 79 indicators, I was amazed at the connections. You heard about the access to agricultural land. That's fabulous, but we ranked very low about bringing fresh foods to people. So there are some clear opportunities around working better and working smarter. And I would call that working in the policy arena, the systems arena, and in the environmental arena. We need complete streets. We need streets that are accessible to everyone, so people can use their cars, but so they can bike and walk safely. We need sidewalks. So again, those are the kinds of things that are cross-sector. I'm very encouraged, and I see Steve Votaw here, that really Learn for Life, and I know many of you here may be aware of and invested in Learn for Life, which is trying to address the non-academic barriers to educational success. Well, frankly, that's exactly what we need to do around health, but really it's around community vibrancy and vitality.
Teresa, I'm gonna.
Am I going too long?
A little bit, a little bit.
Oh my gosh, I'm the one without notes. So let me just say there are a few other things. United Way is doing some fabulous work, and then if you want to find out why we're 50 out of 50 as far as receiving public health funding in our state, I'd be happy to talk about that.
Good. Thank you. Last but not least.
Great.
Sorry.
Bobby, thanks for your great work. Doug, thanks for the foundation's great partnership with the Columbus Partnership. We continue to work lots of issues together, and I think that is an important piece of all of this. And also want to recognize Bob Milburn, who was my predecessor, who got this work started a number of years ago, and now you see it kind of come into a culmination. And in year one, you may not get it, and you start to look at the trend data, which I think is very, very interesting. But Bob had a great vision when he and Bobby first started putting this work together. I think you have to be careful. I want to back off a little bit of the question and say we've got to be careful not to drink our own bathwater. And I think that a report like this brings that humility to you to say, hey, we probably all instinctively feel great about our community, and there's no reason that after we actually look at some of this data and we leave the room that we shouldn't continue to feel good about our community, because I'm our big cheerleader and think we're doing great. At the same time, you know, you have to look at some of the facts and you know, have your eyes opened on occasion to say, you know, where do you need to be spending time? At the same time, this is designed to be a conversation starter, not a conversation ender. And so the danger of a report like this, watched it last night, we presented it to the Columbus Partnership, is everybody wants the conclusion of what are we going to do. And my response is a report like this, hopefully, it starts hundreds of different conversations at hundreds of different tables throughout our community. That's where the answers are going to lie. And that's actually one of the surprising pieces for me, because this is hard work. There aren't easy answers that are in any of these. It's all inextricably linked. Poverty is linked to obesity. Obesity is linked to low birth rates. Low birth rates are linked to graduation rates. Graduation rates we know are linked to incomes, which bring you back to economic prosperity. And so you've got to look at it not as an individual report, but in its holistic report. So the danger is you say, well, hey, we're done with libraries because we've got great library visitation rates. And Pat, thank you very much, but you know, we're going to move on to tackle poverty, which seems to be everybody's big surprise, not because it was a headline in the Dispatch today. It was a surprise at the Columbus Partnership meeting last night. And my question was, why is that a surprise? So the surprise was that it was a surprise. It's been dead last for the last decade. And oh, by the way, do you know who we're beating out? Austin, Texas. Well, I thought Austin was the model community that we wanted to emulate. So you really have to dig deep. Actually, for me, I'm not sure what it means, and I'm kind of not afraid to say that. Second big surprise, female firms. I actually just didn't realize that. I think, you know, a stat like that suggests a lot of things. Are the female firms populating on nonprofit boards? Are their leadership populating on other boards of directors? And what's it mean to the leadership of our community? I was very surprised at the philanthropy number, and the stat changed on this one. So we used to measure it by the percent of income tax returns that included philanthropy, and we were high. And now this year we went to the aggregate that said how much are people actually giving, and we're low. And to me, that's a contrast to having one of the best community foundations and the largest community foundations in the country and one of the largest United Way campaigns. Again, I'm not sure what it means, but it was a big surprise to me and one that I'm interested in, you know, digging deeper into. Graduation rates wasn't a new surprise, but rather a reminder. If you go back to the inextricably linked, I don't know which comes first, graduation rates or poverty, but I somehow have a hitch to the Learn for Life and all our educational issues that's an issue. And then I was a little surprised also by art establishments, because Doug and I also did another collaborative effort, the Art Sustainability Report, over the last year. And it sort of told a little bit different story as we dug into a lot of other communities. arts organizations in our own, and so I was trying to juxtapose it against this. So for me, it's not about that hard-line conclusions. It's about, okay, where were the surprises? How do you start to dig into those, start to have the conversations? And that's what I hope we start today. Because candidly, if there were ever any success of Columbus 2020, it was that we had a year-long, 2-year-long series of conversations that started to engage a lot of people. And there were a lot of mirroring things in this, I remember sitting on this stage and saying, if you don't remember anything else, remember that 10 years ago we were $1,000 richer than the nation, and today we're $1,500 poorer per person, and that directly relates to this report's link. But where to focus as a second question, you got to focus on the entire holistic side of the report, because if you just focus on one aspect of it, we're going to be pulling strings for a long time.
Great. All right, well, I think we're at a point where we can take questions from our audience. And while people are, there's microphones. Richard's going to do that?
Yeah, I'll just invite you to come up to the microphone. We always take questions as this is, excuse me, a community conversation. As we've heard, this is just the beginning or a continuance of a very important conversation. Just to let you know, the CMC records all of its forums for televised broadcast on ONN, streaming on CMC's website and the Columbus Metropolitan Library's website. If you have a question, come to the microphone, please introduce yourself, ask your question, and we ask you in advance to not make long editorial comments because we only have a certain period of time. I wasn't pointing to you directly. Thank you.
Yeah, Phil Sorrentino. Change is 25%, in my opinion, 25% how, 30% why, and 50% will. Do you have the discipline? How do we plan on using that formula, and what answers do you have to get that out there in the community to make the changes that you think we need to make?
Well, let me talk about the will. I mean, I think that's why it's important to have, 4 successive pieces of this report and to keep coming back to it. So if you do this one time and you're done and you revisit it 10 years from now. So I think this has got to be about benchmarking against your peers, not being afraid, again, to everybody in the room and the entire community say, here are areas we're doing really well, but here are some areas that we all need to dig deep. And so I think one piece of the will side of your comment, which I would agree with, is the ability to keep coming back, continuing to measure ourselves.
George?
Let me focus on quality of life, and that would be specifically how the community seems to rank in the lower percentile of the arts. And I find that really surprising, in as much as you have Columbus Museum of Art, Wexner, you have the ballet, you have so many arts organizations in the interior, and then you have the perimeter with Dublin's Center and the McConnell Center. I just wonder what other cities are doing so that they could be ahead of us.
And let me start with for a minute just about what the indicator is. So with any of these, particularly in that community well-being section, you've got one snapshot there. I mean, we pick an indicator, and we look for things that can be normalized, that can be apples to apples. So it is a, I think, per capita number, arts establishments. I'm looking at Devin Keithley, who did all the work on this, by the way. So it's a per capita number, and we've done it a couple different ways. We worked with our advisory committee about, do we have the right kind of groupings and our right definition of arts establishments. So it is one measure. It's not a measure of quality. It doesn't really differentiate between the big institutions and a small institution. So I think it's one measure, and this would be a case where you'd want to deep dive and say, okay, this tells us one thing, what does it tell us? But what other measures do we have to give us a more complete picture about arts establishments? But it is, no matter how we've tweaked it over the last few years, we still do, in a per capita way, come out near the bottom with these other, compared to these other communities.
But I'm going to jump in and say that on that one category, we spent, and there's an entire report called the Arts Sustainability Report that dug deep into the arts, to try to unfold and expand all the various aspects of just that one question for our community. So I actually would sort of agree that I think we've got, on the one hand, a healthy arts scene. On the other hand, there's some real funding issues and challenges that are alive and well in the arts community.
Anybody else?
Hi. My name is Linda Flickinger, and among other things, I'm on a development board for Star Columbus. It used to be called the Hannah Neal Center. So I was in a meeting this morning, and there was a briefing on ABLE and Perkins, and there's a lot of money in that program that's being directed by the state. So, and those are workforce development kinds of monies, if you aren't familiar. So as I was sitting here today, then I was thinking, in my experience, which is limited, but what is it that, and what can we do better to provide stronger synergy between the nonprofit community, which is alive and well, and like this report talks about, needs to grow and expand its influence, and these monies that are, coming to the state for us, to better our community. I'm just not seeing a strong enough collaboration and communication. There was nothing discussed about, nonprofits being partners or discussions with nonprofits in those decision-making pieces. And so I just wondered if you had some comments about that, especially like, the Columbus Foundation and your experience, Alex, or whoever. I would like to see more synergy, but maybe I'm missing it.
So what the report really didn't address is the collaboration between government and the nonprofit sector. So, my earlier comment about strengthening the nonprofit sector is probably one of the more critical things we could do as a community, because they are often that frontline defense for a lot of our community issues. And I think that we also have to realize that government funding is not going to be the solution for many of our community's challenges. And there's only two directions the city can go, right? You can either be going up or you can be going down. And back to the comment the gentleman made earlier, which is, what is our will as a community to be investing in top performing nonprofits, and are we being innovative and entrepreneurial in our approach to social issues?
Okay, my name is Kiana Williams. I'm with the Human Service Chamber, and this question really is for anyone, but I'm actually going to kind of piggyback on a comment that you made, Alex, where you talked about the meeting that you were in, and people wanting to pound the table, and you asking people to kind of go a little slower, and I just wonder, when we look at some of the data that's really challenging in there, is it really because we haven't pounded the table enough? Is it really because we haven't necessarily been as aggressive on some of those really challenging statistics, around the nutritional rates, around poverty, so on and so forth? I mean, I think that maybe we should be pounding some more tables.
Yeah, I think that's a good point. I don't think I'm suggesting that you don't pound the table. I think what I am suggesting, though, is that you have to be careful on this inextricable linked, idea that if you want to pound the table on the poverty rate, you better understand all the various aspects that are going to impact the poverty rate. I think what a report like this can do, though, is to call people into action. And so, I'm glad there's the blazing headline in the Dispatch this morning. I'm glad that yesterday some civic leaders were pounding their fist on the table and saying, oh, wow, now they didn't have answers, but, it was a wake-up call. I'm glad a room like this, so I do think that's a large piece of the platform. When we did the economic development study, we would often say our river's not burning, but we have this secret sleeping giant of slipping in personal incomes. And so sometimes you have to bring those out to get people to try to cause an action. My surprise, though, is if that, I'll just keep picking on poverty rate. Poverty rate was the same 10 years ago, and we reported out on it now 4 or 5 different times. Why is it? I don't suggest that we don't need to take it on and figure it out. I'm just surprised that everybody's surprised.
Heather? Yeah.
So yeah, I'd like to comment on that. So it's not just about pounding the table for me, it's also about wanting to understand the issue at a deeper level, right? So one of the other things that's changed in the past 10 years is there had always been a historical relationship. When jobs went up and unemployment would go down, poverty would also go down. That changed around the early to mid 2000s. That's a function of the fact that the jobs we're creating haven't been paying living wages, right? So it's not just about understanding and pounding the table, but we should be pounding the table to better understand what's happening in our community. And so I hate to say we need more studies, more research, but we have to constantly be studying what's happening and understand it as completely as we can so we can make that right intervention.
And I would say this is a little bit going to be counter to that, which is, and I shouldn't even say this, like my board would not be happy, but there's a point at which more studying is avoidance. And so I would also say that there's a way, the reaction to this is, it's complicated. It's all these different pieces. Everything affects everybody else. And I guess my challenge would be, we got to start someplace. And you know, how do we now get to the conversation about what does this mean for actual people, families, businesses? Are there some things we can do? We're lucky in that we are this, there's these two parts of Central Ohio, which is not the case in a lot of Midwest cities. Although we're having these issues of poverty and decline, we also have growth, lower unemployment. We have assets that a lot of communities don't have. So how do we just get this, you know, out of the realm of, oh, it's complicated and we can't figure it out, to can we start something? And that, you know, that's something I would put out on the table.
I think we also have to hold people accountable to different aspects of the report. I'll pick on low birth rates. I'm on the board of Children's Hospital, and Nationwide Children's is doing some fabulous work around, in collaboration with Ohio Health and Mount Carmel and Ohio State Medical Center. And we need to hold the healthcare community responsible for, you know, their component and their ability to influence low birth rates in our community, which, oh, by the way, are going to have this ancillary impact. And so we can't be afraid to take pieces of the report and call out, you know, good performance and bad performance. I might pick on graduation rates. You know, so are we going to call it out? Are we going to demand better from those in our community who are tasked with and have the mandate for graduating educated kids? Now, that's you know, slip into, you know, dangerous, slippery territory. But I mean, so I think that's another thing you can do with a report like this is, you know, praise the good and hold accountable that it's, you know, not meeting the bar.
James Flynn. First, I would like to say thank you to the Columbus Metropolitan Club for hosting this event. I think it's a great forum, and I salute you. I also want to thank the panelists for their contributions to the community. I am a transplant to Columbus, Ohio, from upstate New York. I believe Columbus is a wonderful, wonderful community. And I guess the challenge, and I don't want to editorialize, but what are we doing to market the strengths of Central Ohio and Columbus to the outside world? It's easy to look at our problems and say, hey, we can be better. That's true. More work to be done, plenty of opportunities for improvement. But what can we do collectively as a team across all these various silos, organizations, work streams to get the word out to the whole country about what we have that's working and the great things about Central Ohio and Columbus? Because I think, and my belief is that we're not marketing ourselves. We have Les Wexner, The Limited. We have great retailers, but we don't market ourselves. So I think we need to start marketing our strengths, get the word out, and really work together as a team to spread the word about all the great things happening here. And I think the boat will rise and lift a lot of these, help solve some of these issues. Thank you.
Anybody want to comment on that?
Yeah, absolutely. So this is one thing that a New Yorker and a Southerner can absolutely agree on. We can understand each other. You know, look, I think the biggest thing I would say is we probably all agree. And because we all agree, I believe there's a movement afoot in town, whether it's with Experience Columbus and Columbus 2020, the Chamber, the Foundation, or a lot of other organizations to really try to tackle that, tackle it as a part of the city's bicentennial, tackle it with silly little things like how we write the word Columbus on everything from police cars to stationery. So I think there are a lot of things that we must do if we're going to, control our destiny on the marketing and imaging side. Enough people have heard me champion that. I just want to say amen to what you said, because I think we've got to continue to break out of this Midwestern modesty and tell the great Columbus story. Despite some challenges that we have, every community's got challenges. We've got to continue to do a better job of collaborating and stacking hands. So last night, before the OSU basketball game on CBS, was the Victoria's Secret's runway show. And that creative genius comes from Columbus, Ohio, not from New York. And the world needs to understand that.
Unfortunately, although there are people in line, I think we have to call it quits. It's 1:15. Want to continue the conversation out in the lobby? There's coffee, there's some cookies. The cookies are pretty good, by the way. Come next week. You want to hear about restaurants, you want to entertain your friends. The next week, we've got Michael Moritz on the 13th, the Bill Smith Legacy Forum, and Jingle Mingle. One more thing. Thank you to the Columbus Foundation for sponsoring all of November, and to the Dispatch, and to McAlvey for today. And thank you to Alex, Dr. Long, Michael, and Bobby. Thank you.